This is a very good chart that shows about second and third degree again, and the time and the temperature is very important. Again, 120 degrees, 5 minutes, 140 degrees, 5 seconds. Now, if you think about it, 5 seconds is not that long. So if you have a patient that is exposed for 5 seconds, then you would have a deep second and third degree burn, and certainly as we go higher than 155, it takes a second or less to produce a very severe injury. Many times there are issues that are related as to, well, if the patient is being exposed to such temperature, why is the patient still exposed? Why doesn't the patient leave the shower in the case of a grown-up that can do it? Many times there are some other issues, and there are issues related to burn shock that do not allow the patient to quickly exit the area. Again, this is very, very important because it's what always comes up in litigation. How long was the patient exposed to the injuring agent, and how hot the injuring agent was. Let's talk a little bit about the different types of burn besides the scalding burns that we also commonly see in a burn setting. And those are electrical burns. Electrical burns are either work-related burns or are related to people doing work around the home. There's a difference between a flash electrical burn and a true electrical burn. In a flash electrical burn, what happens is that there is a production of heat, and the patient gets burned by that heat production secondary to the flash. But in a true electrical burn, the current will go through the body of the victim. Those, of course, are much more severe. Many of these injuries will end up in either amputations or will end up in immediate death. So these are very, very severe injuries that require immediate attention. Going to chemical burns, again, most commonly occur in a work environment. These are very, very tricky burns because some of these burns do not manifest themselves right away. I'm involved in many cases in which the initial plant in which the injury occurred just showered the worker and did not think much about it, and then the patient goes to the emergency room later on that day or the next morning with a severe burn injury. So these are extremely tricky type of burns. Traditionally, alkali burns, they go deeper than an acid burn. They may be more severe. And these are burns that require, most of the time, burn center management, and they have to be appropriately treated. Contact burns are those that are produced with either cold or hot devices. Many times people will have ice applied, particularly after surgery, and some injuries may or may not occur related to the icing. Other forms of contact burns may occur when the patients use heater, either room heaters or massage and heating devices, and of course frostbites for people that live in cold climates is another injury that is treated in a burn center environment because it's basically a cold burn. It's like a burn injury, and it is treated as burn injuries. All of these type of injuries are commonly seen in a burn center and commonly causes of litigations. So these are areas that we have to be quite aware. The other area that is very common is areas related to flame, flash flames, and of course smoke inhalations. Apartment, building, structures do go up in flames. and of course the issues are related as to how did the burn start? Was it a faulty electrical device? Was it electrical wiring? And of course, litigation proceeds from then on. Other areas of concern are related, of course, to appliances, and burns that are related to appliances, either to the stove, sometimes to microwave, and certainly anything that is related to gas, gas line explosions, and issues of that nature are also commonly seen in this consideration. Smoke inhalation. Smoke inhalation is many times the cause of the injury. Many people do not die from the burn injury, but they die from smoke inhalation. Certainly the lungs are affected. Patients need to be intubated, put on a ventilator, and managed. They may require several bronchoscopies, and again, people that sustain severe smoke inhalation are inidus for infection. Then the smoke inhalation will go into pneumonia, and ultimately many of these people die, not so much from the burn per se, but from the smoke inhalation. And also, of course, sometimes there's no burn, there's only smoke inhalation that leads to either a tremendous injury or death. First, second, third, and fourth degree, we discussed those. Sometimes it's very difficult to make a differentiation as to what is what, and even in a burn setting, we may require a few hours or days till we can determine for sure what is the nature of a burn. Superficial and deep partial thickness. The reason why there is a difference between those two is because a superficial second-degree burn, which is basically a blister, many times is treated conservatively, while a deep partial thickness burn or a deep second-degree burn, for all purposes, many times is treated as a third-degree burn, or also known as a full-thickness burn. Consequently, there is not that much difference between a deep partial thickness and a third-degree or full-thickness burns, and many times they are treated likewise.